Hey guys, and welcome back to my channel. If you're new here, my name is Libaso Mpereki. I'm a third year nursing student currently, and on this channel I make videos about everything to do with university life, nursing school, and international student experiences. So if this would be the type of content that you'd be interested in, definitely comment down below and join the family. So in this video, I'm going to be talking about the different nursing assumptions that you guys have about nursing school and nursing in general. I did a poll on my Instagram and Facebook, and I had a lot of assumptions come from you guys. So if you'd be interested in participating in all these polls, definitely follow me on Instagram because I'm more active there. Anyway, so the very first one is nurses are rude. I know, but I have to defend my career and have to say that not all of us, which is a fact. Honestly, it is not all of us are rude. There are unfortunately some bad apples within the nursing field, and they end up giving the whole profession a bad name. But also please note that sometimes you do catch us off guard. Sometimes we are short-staffed, we're just really having a hectic day. And sometimes even the patients themselves react inappropriately, and as a result, we somewhat retaliate. But obviously, we should learn how to control our emotions in that sort of thing. But there are some that are just blatantly rude all the time. For me, I think the main reasons is one, they've either never had the passion for the profession or they've lost it along the way because of different circumstances. Some people just really have bad tempers and they are really patient that can rub you up the wrong way, and as a result they end up retaliating. And then some people, they don't know how to phrase things out properly, because I've had instances where a nurse was telling me something which I needed to know, but the way she put it out, it sounded so rude and so unnecessary. And then when I later spoke to her after we got acquainted with one another, I told her, honestly, I feel like you were really rude in the beginning. And she really apologized, and she's like, I didn't realize that some people took how I spoke in the negative way. Honestly, defending my career here, not all of us are rude. I've met some really awesome nurses, so please, no, not all of us are rude, but there are a few. Next assumption is that nurses eat their young, or the older nurses eat their young. So if you've never had this phrase, it pretty much just means that usually the older nurses are either very blatantly rude, abusive, or just really not accommodating to nursing students. And as a result, they make it very difficult for us to learn. And some students actually end up leaving the profession because of the horrible experiences that they've had. And unfortunately, this does happen where the older nurses, either they don't want to teach you, they don't want to supervise you. If you ask questions, they'll brush you off. They just really make the whole profession or the whole experience of you being in placement really toxic, which is the next assumption I'm going to talk about. And they just make it really difficult for you to be in that profession, because I've literally had a nurse say to me, I don't like students, I don't like teaching them, which is rather unfortunate, because how they got to where they are now is because of someone else teaching them. So I find it really unfortunate that someone else would not want to teach someone coming after them. Wouldn't you want to make life easier for someone coming after you, because you know the experiences that you went through as a student? But unfortunately, some really make it difficult for you. And then the next assumption is that nursing is toxic. Unfortunately, it's true. And toxic in this context is when someone is adding unnecessary negativity and just difficulty in your life that's unnecessary. Some, they will abuse you by giving you a lot of work, and literally the staff will sit down and not do anything because, hey, there's students there, and they just say, student, you must do this and that sort of thing. And then if something goes wrong, usually the student would take the fault for it because they were either not under supervision and they were just overworked. And also, I know with some cases, the language barrier is a big thing. Sometimes you can go to a hospital that's got predominantly Xhosa speakers, and if you don't speak Xhosa or don't understand, they won't translate for you. There are some hospitals where it's predominantly Afrikaans. They do their handover nursing report in Afrikaans. If you don't understand Afrikaans, you are disadvantaged in that case. So in those contexts, it really can become toxic. There's even come some points where the nursing students and the staff have actually fought, and some students have had to be moved because either the nursing staff has some agenda against the students that are coming in, and that whole thing. So the whole thing of nurses eating the young and making the whole environment toxic definitely come together, and it is unfortunately an assumption that is true. Obviously, it's not with every hospital. I've never really had a serious incident. So please just be aware that this is something that you might experience during your nursing process, during your nursing education and training. But please don't go into nursing thinking that's going to happen to you. For some, we end up leaving nursing without ever having such horrible experiences. So obviously, now what sort of solutions can we come up to remedy this? For me, I feel like there needs to be better communication between the universities and the placement areas that we're placed at, because multiple times I've gone to a placement and the nursing staff doesn't know that I'm coming. Also, they don't know what competencies or things that we are meant to be learning in that facility. Yes, us as students, we're meant to tell our facility, but I just feel like they should be better prepared so that they know how to allocate us. Because if the unit manager or the head registered nurse there knows that, okay, we've got third year nursing students that are coming, they need to deliver babies, they need no witness, they need to do episiotomies, etc., etc., they know how to allocate us during the day instead of pushing all of us to do admissions and doing your vital signs. Because as a student, they're going to make you do vital sounds like no man's business, and you literally have to just be very forward and assertive and say, no, I can't do vital sounds the whole day, I need to be doing this and that sort of thing. So I definitely do think there needs to be better communication, so that those, because there are some nursing staff that really want to know what us as students are meant to cover, so that they can better prepare us and that sort of thing. But if the placement itself doesn't know that we're coming and all of that, it just makes life very, very complicated. Another problem that we have is the way that our schedules are set up. I've had one of the operational managers complain that our university, the way they set up our work schedule is it's all over the place. Like, for example, when we were in first year, we were working once a week. So let's say you're coming to work on Monday, and then from Tuesday till Sunday, you are missing out on what's happening in the hospital. And then when you come back the following week, you have to relearn because you've gone a whole week being away from placement and that sort of thing. It does get easier the higher you go, but I feel like it will be much easier for us to learn, and also makes it easier to interact with the nursing staff if we work according to how their schedule works. We had some sort of block system so that we add a placement for long periods of time instead of just jumping around all the time. It would make life so much easier. And then the last thing is there definitely has to be more compassion from the nursing staff, because we are students. We are going to make mistakes. We're going to feel so lost. We're not going to know anything, especially if it's your very first time in that ward for a new discipline that you're going into, or even if it's a new hospital. Different hospitals work differently. In government, there's some form of uniformity, but obviously how things work is different, and it takes us a while to get used to it. So I really do urge all the nurses out there to just be more compassionate and more patient with us, because I know it really is frustrating having a student ask so many questions, and then sometimes they make mistakes that delay a lot of things. So just be patient with us. And also teach us how to do it properly the first time. Don't just assume that our university has taught us, because there's some certain things that the university can never teach you. Like, they can never teach you how to take a Visidex. They can never teach you practically how to mix certain medications and that sort of thing. Those are things that we are taught in the placement. So show us how to do something once, so that when you ask us to do it a second time, we know what's happening and you can supervise us in that sort of thing. Because I feel like that's where most of the mistakes happen, where they don't teach us the first time and then we sort of try to maneuver ourselves into it. And also, if they don't want to supervise us for things, then it's just a whole nother issue. And once we have become comfortable and you can see that we know how to do a certain procedure, please don't hover over us and want to see every little thing, because there's definitely extremes to everything. Those that don't want us to supervise and those that want to literally watch every single thing. It makes us super anxious, and it makes us scared to try anything new because we don't want to be shouted at because we're doing it wrong and that sort of thing. Allow us to have that freedom to try things out by ourselves, and then be there for us to be able to ask questions if we don't know how to do something and that sort of thing. Because yes, the first time that we do a certain procedure, it might take us a long time than it would if it was a registered nurse, but just allow us to ease into things instead of bombarding us with things and that sort of thing. But yeah, anyway, that is the solutions that I have. Next assumption: night nurses don't do anything because the patients are sleeping all night, which is highly untrue, highly incorrect. That's the word I'm looking for. So when it comes to night stuff, yes, I would say there's less work than it is during day, but it doesn't mean that we're not doing anything. Yes, we don't have a lot of doctors' orders happening. We don't have dietitians, physios coming in. There's less movement, but there are still a lot of things that we need to do. So when we come in, we need to make sure that the patients have been changed, they have been turned. There's usually would have had their supper just before. We need to make sure that their vital signs are done. We need to make sure that they're getting the medication. Most of the antibiotics are given at night, so all those IV infusions need to be done, and that can take a really long time. Then there's nursing reports that we need to do, and sometimes we're even fixing the storeroom so that we're making life easier for the day shift. So that can take the whole night. So just because the patients are sleeping does not mean we're not doing anything. And I don't know what happens with the universe at night, but a lot of things do go wrong. But this is in my own experience. It's like every time I've been on a night shift, I've really had a night where it was quiet, it was chilled. Usually there's either the patient's temperature is spiking, their blood pressure is either dropping or it's plummeting. We've had resuscitations. So at night there's a lot of things that can go wrong with the patients, and their conditions really deteriorate really quickly at night. So we really are busy, even though it's much slower pace at night because there's not a lot of movement. We are not doing nothing the whole night. Please just take note of that. Nursing is emotionally draining, which is true in a lot of different aspects. So let's start with the school part of it. So with school, you're dealing with a lot of assignments, you're dealing with hectic schedules, you're dealing with your own personal issues that are affecting your schoolwork, you're dealing with dysfunctional admin stuff that's just not going well. Sometimes there's messes in schedules, there's just a lot of miscommunication that happens within the students or within the lecturers and that sort of thing. So all of that can really be emotionally draining. Like I think this week I've had so many fights with my group project, with school, being a deputy class rep, which I left. But anyway, so it's emotionally draining in that context because it's just a lot of work that you need to have done. And then now they add on the clinical part of it. In clinical, you're juggling your working hours. Like in third year, I've been working 3 days during the week, and then Thursday and Friday is dedicated to my classes. So for 3 days of the week, I'm working, and sometimes even weekends, late hours, early mornings. But in addition to that, I still have group projects that I need to give in. I still have projects that I need to do. I need to study for tests. So that whole thing can really become emotionally draining and just tiring and exhausting. And then also you've got the actual work environment. Either you've got a really nice working staff, or if you've got a horrible nursing staff, the patients are being difficult, you are short staffed, you don't have resources, there's a lot of emergencies that are happening, there's a lot of people shouting at you to do things. So all that in combination can just be really exhausting, emotionally draining, especially if you're losing patients or something bad is happening and that sort of thing. And then obviously there's the personal part of it. We all got personal lives. There's a lot of things that happen on that aspect of it. And then also if you're doing a side thing, like I've got YouTube, I tutor also, all that in combination to one person can really become a lot, and you just feel like you want to scream, pull your hair out, just cry. And it's okay. There's going to be moments where you just need a day to just not do anything, just be all in your feels and that sort of thing. And it's okay. Obviously, don't stay in that moment. Just get yourself together, but just be aware that it's true and it is going to happen. But if you can manage yourself and you've got a good support system, you'll be fine. You'll be able to handle nursing school. And then this brings me to my next assumption, that nursing students don't have a social life. I would say partly I agree with it, because there's going to be a lot of functions that we're going to miss because we're working public holidays and we're working weekends. So in that context, we don't have a social life because we can't control our schedule, if that makes sense. So I can't say, okay, I've got a function on the first, I'm going to go to it, because I have to first look if my school calendar is allowing me to do that. Whereas with other people, they've got the freedom to do that because they don't have the practical part of it. So in that context, we don't have a social life because majority of our free time is taken over by school. But you can also still have a social life. I still go out, I'm still managing to do YouTube at the same time. So as long as you manage your time and you're managing how you're doing your work and you organize and making sure everything is scheduled and you're doing it at the appropriate time, nothing is being done last minute, you definitely can have some form of social life. It will not be as flexible as with other students that don't have the working component, but as long as you know the days that you're off, you're scheduling it to see your friends, you definitely have a social life. You just have to find friends that are very understanding of your schedule, because a lot of your time is going to be taken for placements. But if you can communicate well and say, look, on this specific day we're gonna go out, no changes to it, you'll be fine. Yes, your friends will find it very annoying that you have to send them a calendar and tell them to pick a specific day that you're free, instead of just randomly making up plans last minute and that sort of thing. But they have to understand that you're a nursing student and you have to balance both. Next assumption is that there's a high job security in nursing. And with this one, it's yes and no. Yes, because nurses are needed everywhere around the world, and in South Africa right now, we've got a shortage of professional registered midwives, so there's definitely a demand for nursing. But the issue comes where there's not enough, in a South African context, there's not enough budget to be hiring as many nurses as we need. And as a result, now we have an issue where nurses are graduating, but they're not able to find permanent posts. But if you're in the hospital setting, and we can clearly see that the hospital should be hiring more nurses, but there's not enough budget for them to do that. And as a result, there's not that great job security in South Africa, because you can graduate but you're not able to get a permanent post because the hospital does not have enough budget to be able to hiring as much nurses as we need. So partly there is job security because you can obviously go overseas and work and that sort of thing, but in a South African context, unfortunately, it's not as guaranteed. We've got a lot of like ComServe sisters right now that have just finished their community service and they're unable to find placement, and they're having to work with agencies where you're moving from hospital to hospital because no hospital is having permanent posts. Next assumption is that all nurses ever do is clean after patients and after doctors. Literally, we are the servants of the hospital, which is highly, highly, highly incorrect. It obviously depends on your rank. So for example, if you're an enrolled nurse, you've got your scope of practice limits you to a certain degree. So there's certain things that an enrolled nurse can't do. So enrolled nurse, they do general nursing care. So you're taking a vital signs, you're feeding patients, you're turning them, and that sort of thing. So in that context, most people would think that all you ever do is clean up after patients. But obviously, if you're a staff nurse, then you've got added things like you can deal with medication, you can deal with AGTs and insulin and all of that. Obviously, if you're a registered nurse, then you've got a lot more things that you're handling, like you're doing your IVs, antibiotics, and there's certain things that a higher nurse can do than a staff nurse and that sort of thing. So no, that's not all we do. There's a lot more things that we do for our patients, but obviously it depends on the rank that you have. The next assumption is that nurses aren't smart enough to be doctors, which is incorrect. We all choose to go towards the medicine route or nursing route for completely different reasons, and both careers expect you to be smart and to have good marks for you to be able to gain entrance. As a result, you should not compare the intellect that is needed in one and the other. And we entered nursing because we had a passion for how the nursing field functions compared to medicine. If you want to know the reason why I chose to be a nurse, definitely click the link in this video. And then the next assumption is that nurses are females and doctors are males, which is, I wouldn't say it's true, but the ratios really do paint a different image. And this is because of the history of both medicine and nursing. From a nursing point of view, nursing was seen as an extension of the domestic work that a female did, and most nursing happened in the home where you had to nurse the family members and that sort of thing. So as a result of nursing developing and being recognized as a profession, most of the first nurses that were there were females. I'll speak a lot about this in my next video about the history of nursing. But as a result of that, nursing predominantly was a female job and medicine was a male job, because obviously during that period in time, only males were allowed to work. As a result, males were the ones that were trained to be doctors, and then obviously nursing came after that. But obviously this is something that is obviously being rectified as more and more people come into the profession, and it's not the same in all provinces, but the stats don't lie, I guess. It's hard to talk to doctors. In the very beginning, it really is, because you feel really intimidated. You also don't want to look stupid, and you also don't want to feel like you're inconveniencing them and asking them unnecessary questions. And that sometimes there's things that we take to the doctor that should actually go to our registered nurse or someone who's supervising and that sort of thing. But I mean, if the doctor is there and the patient asks, shouldn't you just ask? So in the very beginning, it's difficult, it's nerve-wracking, and sometimes there are doctors that are quite offish to students and they don't want to answer questions. But in other times, there's like really amazing doctors that will literally take their time out to explain everything to you and that sort of thing. So with everything, there's some good and there's some bad, but you definitely should not be scared to talk to your doctor, because one day as a registered nurse, you're going to need to advocate for your patients to your doctors. So you need to be assertive and be able to approach the doctor and speak to him. And they're all human, they're just like us. Just because they've got the title of a doctor does not mean that, you know, they're God and you can't speak to them. So definitely speak to your doctors. There's a lot of things that you can learn from them if you're just willing to ask and just putting yourself out there. This assumption is very interesting. Nurses are rich. I think the term rich depends on your type of lifestyle and context. Average in South Africa, nurses earn about 17,000. This is obviously minus tax. So if you can afford your lifestyle with 17,000 and still have extra to, you know, do fun stuff and that sort of thing, and you think that's enough for you to define rich, then of course nurses are rich. But if you've got a lot more expensive and, you know, you like the finer things in life, then obviously 17k is not that much. But obviously if you go overseas, they get paid a lot more than nurses get paid in South Africa. And obviously if you're doing things like cruise ship, that sort of thing, you're getting paid like 50k a month. So it all depends on your context and your lifestyle. But in a South African context, personally, I would say no. Nurses are not rich at all. We're getting paid peanuts in South Africa, and I'm hoping this gets changed over the next couple of years. But yeah, nurses gossip about patients. For me, I feel like there's a difference between gossiping and learning through talking about the patient. Obviously, gossip is the blatant, you sort of judging the patient for the decisions that they've made and saying, no, I would never do that, or bad mouthing them, then of course that's blatant gossip, and it does happen, especially in the tea room. But then also there's the part where we need to speak about our patients, what they're going through, their social issues, and sometimes we end up talking about their personal issues, like their relationship with their family members and that sort of thing, within the learning context. For example, we had a patient who came in, we did her vaginal examination, and she was extremely hysterical. As a result, after that incident happened, our registered nurse took us aside and she explained to us that there's some social issues that are happening. So in those contexts where we talk about our patients in a learning environment where our registered nurse or our supervisor or our lecturers are teaching us about the patient and their condition, then in that context it's okay, but obviously it's under that supervision. Next assumption is that nursing is expensive, which is totally true. Going to nursing school is really expensive, and with nursing there's a lot of hidden costs. There's a lot of things that come up that you wouldn't expect, but you just have to do it because that's the education that you have. You need an education. So you've got your tuition, then you've got your uniform, then you've got your textbooks, then you've got the equipment that you need to use, then you've got your traveling costs. If you're on residence, then you need food, you need an allowance. There's so many things that you need to be paying for. So as I've preached in many of my videos about applying to nursing, please make sure that your budgets are together. It will really make your life so much easier than going into it and seeing how it goes. It just gives you so much stress and anxiety, and those emails from your student credit management they just ruin your whole mood. So yeah, anyway, but nursing is expensive and you need to be aware and in control of your budget. Nursing, you teach everything to yourself. Yes, because obviously you need to take control of your own education. The lecturers will give you the information, then you yourself, you need to go home, you need to learn the information, you need to understand, you need to practice, and that sort of thing. So in that context, yes, you're teaching yourself. But in the other context, you've got amazing lecturers that will give you all the information that you need. They'll teach you everything to make sure that you understand. And you literally just go home, revise, and you know everything. So in that context, you don't teach yourself. But also there's another context where the lecturer is not that great at teaching the information and you don't understand, and you actually end up reteaching yourself that chapter or that whole module because you don't understand anything they're saying to you. And for me, I've noticed this a lot, especially in the digital phase that we're in right now with online learning. There are some people that I think would be great lecturers in a physical context, but online it just doesn't translate well, especially when they're just going on and on and on and on. You need that physical interaction for them to actually put two and two together. So there's pros and cons, but at the end of the day, you have to teach yourself to make sure that you understand the work. Nursing does not teach you anything, you learn everything on the job. Partly, yes, you learn everything on the job because in a university setting, there's certain procedures or certain things that you do physically on the job that they cannot teach you in a university setting. They're teaching you the theory and the knowledge behind whatever you're going to be doing in a practical setting. And then in addition to that, there's certain things that you can never learn in a university that you just have to experience on the job. And I feel like most of it is on the job because you have the theory, but you will never know physically how to treat a patient who's got a cardiac issue. You can never learn anything from theory how to treat a patient with bleeding. You can never learn anything from paper how to deliver a baby. Everything is by you interacting with the information. Nursing is a very practical job, and as a result, everything or majority of the things that you're going to learn is going to be on the job. They can never teach you the different conditions. They can never teach you how to interact with the different patients that you find. There's just so many things that I added on to nursing, and there's so many factors that affect how you treat your patient that you can never learn everything in a university setting, and as a result, you have to learn most of the stuff in a practical setting. And then this one, nursing is very difficult. I wouldn't say nursing is difficult. Like, I haven't found anything where I've struggled with it for a long time. Like, if something is difficult to you and you apply yourself, like you're watching YouTube videos, you're going for tutorials, you're doing practice questions, you're putting in the hours for you to learn that work, trust me, you eventually understand. So for me, I don't think nursing is hard. It expects you to work hard because it's a lot of information that you have to take in, but it's not difficult as long as you're prioritizing your scheduling and you're putting in the hours to actually physically study and not just passively read the information. Then nursing won't be difficult for you. And with nursing, you need to practice. Like, a lot of the things that you do are practical. So once you're in the clinical setting, make sure that you're putting yourself out there. If a nurse is busy doing something and you've got nothing to do, go in there, open the curtain, see what they're doing and interact. That's the best way that you're going to learn, because you might be book smart, But if you're not practical smart, nursing is not going to go well for you, because nursing is very practical based. The very last one is nursing is fun, which I 100% agree with this assumption. Nursing is amazing. I love everything that I've been doing, all the conditions that I've been seeing, the experiences that I've had with my patients, with my nursing staff, and that sort of thing. But at the end of the day, nursing is what you make of it. If you're going to be complaining, bitching, and moaning, and just being pessimistic about everything, then obviously you're gonna have a horrible experience in nursing. But if you tell yourself that, okay, things are not always going to be rosy, it's not always going to be easy, but you know you're enjoying what you're doing, then definitely nursing is going to be so much fun. Thank you guys so much for watching up until the end of this video. If you have any more questions that you'd like to discuss, or you've got comments about the assumptions that I've made and the comments that I made towards it, definitely comment down below. I would be interested to hear your thoughts and all of that jazz. Until next week, Friday, 12 p.m. South African time, have an awesome day. Bye, guys. Oh, by the way, don't forget to subscribe and share. Okay, bye.